Sup everyone, I hope you're doing great. Welcome back to my YouTube channel. So today we're going to do something towards the medical direction. I have a friend who reached out to me and said, Linda, can you kindly do a video on endometriosis because it's endometriosis awareness month? And I thought, yeah, why not? Because a lot of women experience this. So I hope you really enjoyed this video and I hope you learned a thing or two from the video. Don't forget to subscribe, like, comment for more videos. Stay tuned. So what is endometriosis, you might ask? Endometriosis is a really painful disorder where the lining of the uterus is found outside the uterus. Okay, so basically for every female, we experience the menstrual cycle monthly. Okay, so this occurs by the lining of the lining of the uterus being thickened, and then it sheds the blood if there's no pregnancy, and we say, "Ooh, you've gotten your menses," right? But for endometriosis, the lining of the uterus is outside the uterus. Okay, and it can be anywhere in the pelvic region. Okay, the ovaries, the fallopian tube, sometimes even the rectum. It's literally like just everywhere, just outside where it's actually supposed to be, right? And then, yes, it thickens as the menses approaches, but instead of shedding, there is no way out. So it's just gets inflamed and causes excruciating pain to the woman. Okay, and I talk about it with passion because most women have painful menses, and so even if they tell the next person, the next woman, "Oh, I'm having really bad cramps," we just go, "Oh, it's menses, it'll be fine, you'll get better," But some people are really going through it, and it's not just cramps, or it's not just like the mild ones where you take paracetamol and it's fine. No, it's endometriosis is debilitating, and most often it makes the woman unable to work for the period of their period. Oh, pun intended. For the period of their menses. Okay, so you might ask, what causes endometriosis? Honestly, there's still research being done because no one can tell you the definite cause of endometriosis. Yes, we are in the 21st century and there's like scientific inventions. We are finding out new things and doing new things. But sadly, we don't really know the cause of endometriosis. There are just a bunch of different theories. The most popular theory being the retrograde menses, which literally means that instead of the shedding of blood, like during the menstrual cycle, and the shedding of blood is of blood coming through the vagina, it literally goes the other way, backflows back into the fallopian tubes and stuff. And so this causes the lining that has been shed from the endometrium to be just stuck to the walls of all the organs in the pelvic region, and this causes it. Others also believe in the theory of hormonal changes, meaning that they believe that increase in the hormones or hormonal imbalances causes the change of the cells from their normal cells into endometrial linings. I don't know. And the third most common is genetics. Basically, since we don't understand it, if someone in your family has it, then there's high likely chance that you might also have it as well. Yep. So there's another theory that is the surgical sites implantations. Basically, it's believed that after you've had like a cesarean section or a hysterectomy, that is like removal of part of the uterus or all of the uterus, depending on which type you have, that some part of the uterine lining gets implanted into the surgical site. So it's literally like outside the uterus at the surgical site, and then this also causes pain. So what are the symptoms of endometriosis, you might ask? Pain. Let that sink in. Pain. Okay. These women have painful menses, and I'm not talking about like your regular cramps, which are already painful. So let's just say you increase that up like a notch. My women in the house can understand that. Okay, painful menses. They have longer periods of menses because yes, usually last more than 7 days, and they're really heavy flows as well. Um, they have they experience pain during intercourse, and this is usually linked to sexual intercourse during their menstrual period. Okay, they experience painful defecation if they're unlucky and these endometrial linings are found around the rectum, in and around the rectum, they end up having either bouts of constipation or bouts of diarrhea, uh, aside with painful defecation. Okay, they also have painful bowel movements. So it's not enough that you're having diarrhea. It's painful as you go for each one. Also, depending on where the lining is found, again, as I said, painful urination. It's like they're just in pain everywhere, every part of the body where the lining can find itself just causes pain. So how do you diagnose endometriosis? Like I said earlier, we do not know much about endometriosis. It takes the average woman about 10 years to be diagnosed with endometriosis. And why is that, you might ask? It's because we don't have a lot of knowledge about it. So basically, it's just the symptoms that help. Okay, so you go to your doctor's office, you tell him or her about your symptoms, you do the vaginal examination. If nothing pops up, they can do an abdominal ultrasound to see. But usually, the only thing that might give away the fact that you have endometriosis is if you have the endometrial cysts around your ovaries or around your organs, and the ultrasound tends to pick it up. If not, the most definite way of confirming that you have endometriosis is by a process called laparoscopy, where they have to actually visualize the endometrial lining outside of the uterus. And how many people actually can afford that? Exactly. And so it takes an averagely about like 10 years because you'll be treated for every other thing but endometriosis. Yeah. So what puts you at risk for having endometriosis? Obviously, if you're a woman. If you have your menstrual periods early or earlier in life, before your teenage years, if your menstrual cycle lasts if your menstrual cycle lasts less than 27 days, if you bleed for more than 7 days, like I said earlier, genetics, if you have any if you have any reproductive tract anomalies, if you have any condition that causes you to produce more estrogen. Estrogen is the culprit here. So what's the prognosis for endometriosis? Basically, it starts off a few years after your menses because you're just getting used to the rhythm, right? When you get pregnant, the symptoms subside a bit, but after pregnancy, they're back. So usually the prognosis is good after you reach menopause. But if you're taking estrogen hormones then, I'm sorry to tell you, you might still have the symptoms. How do you treat endometriosis? You treat it symptomatically. There is no definite treatment for it. Unless, of course, you can excise all the endometrial linings found outside the pelvis. That would be the treatment, okay? Most people advocate for hysterectomies. But how plausible is that if you're a young woman who wants to start a family one day? You can't do that. You can't take the whole uterus out. Okay, so basically you treat endometriosis by treating the symptoms. If it's really painful menses, we try to give some pain meds to help. Okay, if it's pain during intercourse, which is usually associated with the menstrual cycles, you try to find other ways of being intimate with your partner and holding off sex for that period of time. And then if you're having bowel disorders, then we try to give medications for that as well. So you treat endometriosis by treating symptomatically. But some have been helped with some hormonal contraceptives, like the Depo, that's the injectables. If you watch my previous videos, you'll learn about the contraceptives. So the patches, the rings, the depot, anything high progesterone has been studied to help improve the symptoms of endometriosis. But in the same time, as I was saying, if you want to reproduce, if you want to have a family, it gets a bit difficult to do that because contraceptives prevent you from getting pregnant. So yeah, just treat symptomatically. The number one complication of endometriosis is infertility. Like I discussed with you earlier, in trying to treat it, you might actually stop the process of getting pregnant. And unfortunately, when when the endometrial lining gets thickened and there's no way for the blood to go and all that, it forms adhesions, which can block the pathway of the eggs trying to meet the sperm and then making the baby. So endometriosis, number one, is top three of infertility in women. Part of the top three causes of infertility in women. Yeah, because the process itself and the treatments end up preventing conception. And it's been linked to types of cancers, the ovarian cancer and the endometriosis associated adenocarcinoma. Now to the main reason why I wanted to do this video. Endometriosis causes a lot of stress on the woman. It causes them to deal with depression, anxiety, financial difficulties because they have to run a lot of labs, and because there's no concrete examination to easily pick up endometriosis, they run labs upon labs upon labs and they're turned around in every direction, always being treated for something different. Till about 10 years down the line, endometriosis is then picked up. I just wanted to encourage women going through endometriosis to keep up the fight. But we see them, we now know, we now understand, and we support them. For those of us who know people going through this or having endometriosis, I hope they get that comforting shoulder, that comforting hand, and that understanding person that doesn't look down on them because they're in so much pain they can't work like 5 days or 7 days out of the month. I hope you understand that they are in so much pain, not because it's just a girly thing, but because it's a real condition that they are going through. I hope you understand when they are battling with depression. You're more understanding and open for them to be able to discuss with you so that you can be sort of like an outlet for them. And finally, I hope women, when a friend tells you I'm in pain, you don't go, oh, we are in pain, it'll be fine. Okay. I know today's video was really solemn and more medical, but I tried to make it as fun as possible. Well, not fun, but as simple as possible for everyone to understand it. And so I hope you're able to learn a thing or two, and I hope you're able to be that comforting person for someone in need. And yeah, I hope this month of the endometriosis month has been a learning experience for you, and I hope you're more understanding of women with this condition. So don't forget to subscribe, like, comment, and share for more videos. Until next time, guys, bye. Stay safe.